Coming up, we'll be on location at HBOT of Northern Virginia in Reston, Virginia, discussing the benefits of HBOT therapy and how it can effectively treat Lyme disease, TBI, and other health issues with one of this region's top doctors, Dr. Samuel Shor. Dr. Shor completed his residency at George Washington University and received his medical degree from the Medical University of South Carolina. Dr. Shor is a clinical associate professor at George Washington University, and he is widely recognized as one of this area's top doctors. Welcome, Dr. Shor. It's a pleasure having you on our program.
Pleasure to be here.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. We have some patients that we're going to hear from a bit later, Dr. Shor. But I wanted to begin, if I may, by having you please tell us about what are some of the most common problems in the health arena that you see in your patients.
Although we are a personalized general medical care facility, we specialize in the management of chronic illnesses such as fatigue, fibromyalgia, Lyme disease, and by virtue of our experience with hyperbaric oxygen, we've developed an expertise in the management of traumatic brain injury and post-concussion syndrome.
Yeah, you really are a leader in those fields for this entire region, quite frankly. You have built quite a practice. You are helping so many folks each and every day who suffer from these various issues and more. And I wanted to ask you, as far as how do you diagnose your patients when they come in, for example, with some of the more common problems like Lyme disease?
Well, the most important component of determining any diagnosis is the clinical history. It's the picture that the patient paints with their own experiences, their own words, that illustrate the clinical features of what we ultimately will put together as a diagnosis and a game plan. There are secondary features that are gained by physical exam and supplemental laboratory tests, but at the end of the day, it's really what the patient says, for which it's so crucial to listen to what they have to say.
Yes, indeed. So you meet them obviously initially through the consult, and then you do the diagnosis, and then I take it you customize a treatment plan for each and every patient.
Exactly.
And what are some of the treatments that you offer that are available, Dr. Shor, to help these patients?
Well, in addition to the hyperbaric oxygen treatment, which we'll be going into some detail, we provide a myriad of supplemental recommendations, prescription medications. On-site treatments include literature evidence-based intravenous therapies such as high-dose vitamin C, IV glutathione, IV Myers cocktail. We have a device called PEMF, which stands for Pulse Electromagnetic Field Generator, and that's used to help almost instantaneously many conditions of soft tissue and bone injury and pain. And then we are soon to be providing intravenous UV light therapy as well for fatigue, pain, and help the immune system.
Very interesting. You certainly are state-of-the-art indeed. Now, as far as the hyperbaric oxygen treatment program that you offer here, can you tell us a little bit more about that and how that's performed? Because that is really something that really separates you in your practice from many others. It's helping so many folks, and we want you to tell us about it.
To begin with, many people may hear of hyperbaric oxygen, and the most common treatments are for wound management affiliated with university and hospital systems. However, our clinic primarily emphasizes off-label, literature evidence-based treatment conditions, particularly of traumatic brain injury and post-concussive syndrome, the post-stroke state, different aspects of Lyme disease, including augmenting the treatment of using antimicrobials, antibiotics, or frankly herbals may be augmented by this treatment strategy. And there are a number of associated conditions with Lyme disease that can be benefited by this modality of therapy, including chronic pain, cognitive impairment, chronic fatigue, lightheadedness. There are a number of other conditions such as multiple sclerosis, inflammatory conditions such as interstitial cystitis, inflammatory bowel disease, including ulcerative colitis and Crohn's disease. You'll be hearing from a near drowning victim that was helped, and I believe I mentioned post-stroke state.
Yes, indeed. And we're also going to be hearing in a few minutes from a Lyme disease patient of yours, and that is a disease that unfortunately is so many times misdiagnosed.
Right.
And I think in her case we'll be hearing how there was a misdiagnosis where the initial prognosis was that she had multiple sclerosis, MS,
Correct.
and it turned out that wasn't the case, and she's not the only one. That happens unfortunately far too often.
That's true, and she, like several other of my patients, having been diagnosed with multiple sclerosis by well-respected neurologists, ultimately we developed a diagnosis of Lyme and treated her accordingly, and she's in remission presently.
Yes, indeed, and she'll be telling us about that, how the misdiagnosis took place through another doctor, and then she came to you and you accurately diagnosed the Lyme disease.
Correct.
Now, what are some of the benefits of the HBOT treatments that you offer here, the hyperbaric oxygen treatments, compared to some of the traditional ones that have been available for those types of problems?
Well, there are some conditions, frankly, where hyperbaric oxygen is the most effective of treatments that are available, particularly in traumatic brain injury, post-concussive syndrome. In the post-stroke state, physical rehabilitation and time are the standard of care. Hyperbaric oxygen can take people to a higher level. And then in relation to other conditions, multiple sclerosis, there are limits to what treatment strategies may provide, and this is a treatment that does not manipulate the immune system in a suppressive way, but actually augments and assists the immune system in treating the underlying condition.
Very interesting, doctor. It really enhances it and augments it, like you said. Now, is this HBOT therapy performed here at your office, or is it done at a hospital?
We have a clinic that is in the professional building in which our practice is located on the Reston Hospital campus on the ground level. It involves two what we call mono chambers, which are chambers that will accept a single adult individual or an adult and a child. And what it involves is introduction of 100% oxygen into the chamber under a certain degree of pressure, depending upon the condition that's being treated.
Okay, certainly good to know. Now, how many treatment sessions are typically required? And I'm sure that varies, and I put in that disclaimer that I'm sure it depends on each particular patient, his or her situation, but in general, what is a patient looking at as far as number of sessions of this therapy?
When we entertain the utility of this approach, we generally say that minimally 20 treatments, very often more, depending upon the effect that this has on their underlying condition.
Okay, and how long does each treatment typically take?
Each treatment is 60 minutes, we characterize it at depth. It's a dive. So it takes several minutes to get to depth. You're at depth for 60 minutes, and then it takes several minutes to come back from depth. We usually do that ideally 4 to 5 days a week for the number of weeks for the number of treatments that's designated.
All right, and what type of results are your patients seeing from the HBOT treatments?
Across the board, the vast majority of people tolerate it and are benefiting from it on all different levels in terms of their neurologic status, energy, cognition, pain. Most of these are improved in the vast majority of our patients.
And are these results permanent, doctor, once the patient achieves a certain level?
Fair question, and that really depends upon the condition being treated. If an individual is being treated, for example, for traumatic brain injury or post-stroke, if they don't generate another injury to the brain, whether external or internal, then the gains made by this treatment may be permanent. Alternatively, if you have a chronic relapsing condition such as multiple sclerosis or Lyme disease, the condition for which may wax and wane, then you may achieve remission or improvement, but because of the changes in relapse nature of those conditions, additional treatments may be of value. And particularly in multiple sclerosis, some people benefit from maintenance proactively. So every 3 to 6 months going through maybe 3 or 4 or 5 treatments.
Welcome, Jim. It's a pleasure having you on our program.
Thanks for having me.
We always appreciate it when guests take time out of their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, Jim, if I may, by having you please tell us how you heard about Dr. Shor and what brought you here to HBOT of Northern Virginia as a patient.
I'm a combat wounded veteran, and there was a nonprofit organization that was looking to help veterans with traumatic brain injury and post-traumatic stress disorder. And they raised money to send us to get hyperbaric oxygen treatment. And this is the center that they chose as the premier center to send the veterans to for their treatment.
Oh, very interesting. So then you came here, and what happened next?
Well, I came here, it was kind of interesting to see the actual treatment, but it was surprising how well they were able to handle myself and, of course, my service dog. We came in here and they got us in there, and he laid down beside it, and we began the treatments.
And how long did the treatment take, if I may ask?
Each individual treatment took an hour, and I came in for an initial segment of 20 treatments.
Oh, okay. And how do you feel now after the treatments?
I wasn't sure that it was going to work, frankly, but I came in because they asked me to, and it was paid for, and it sounded like something to try. And the problems I was having was I was having memory problems, some cognitive issues. I couldn't think clearly, and I was being confused a lot, as well as a lot of anxiety and anger and various things like that. And I came in here and I went through the treatments, and about halfway through, about treatment number 10 or 11, somewhere in there, I hadn't been able to go to Home Depot, for example, for a couple of years because I couldn't remember where it was. My wife had to give me directions every time we went to tell me where it was.
That was really impacting your life.
It was, and I got in the car one day without even thinking about it and drove over to Home Depot with no problem at all. And I didn't even realize I did it. I had given up on doing bills. I couldn't concentrate. And probably about the same time, I went in and sat down and, without thinking about it, sat down and started doing bills. So it really improved my cognitive issues. And I felt a lot of the anger issues and things that were caused by the post-traumatic stress and other issues starting to fade out. So it actually did help. It really helped turn my life around.
Yes, indeed. We're so happy to hear that, Jim. And for the folks watching, can you please tell us a little bit about what your overall experience has been like with not only Dr. Shor, but the staff here at HBOT of Northern Virginia?
It very quickly became a place I liked to go to because the staff was real friendly. I got to know them personally, and they took care of myself and my service dog, Freedom. Every time we came in, we were welcome. Dr. Shor was incredible. He sat down and explained everything to me. I didn't really understand all the mechanisms of traumatic brain injury, post-concussive issues, and post-traumatic stress disorder, but he helped explain all that. We went through all the exams and the testing and everything, found out what the disabilities were, and got right to work on them.
And before we let you go, Jim, is there anything else you'd like to share with our viewers?
I can tell you that I'm getting 20 more treatments because originally they looked at 20 treatments and then reevaluation. They did the reevaluation with a SPECT scan, took a picture of my brain and looked at the change, the actual change that had happened in the functioning of my brain through those 20. And they figured 20 more are going to help even more. So hopefully I'll see a lot more improvement here in the next few weeks.
Well, we're so happy to hear that. And on that note, we'd also like to thank you for serving our great country and being in the military and doing all the great work you've done in your life and in your career. And thank you again, Jim, for joining us and being a guest on our program. It was our pleasure having you on.
Thank you very much.
Welcome, Joel and Luke. How are you both?
Doing good, thank you.
All right. We appreciate you both coming down. I understand Luke is your 2.5-year-old son, Joel?
He is.
And I wanted to begin with you all, if I may, Joel, by asking you if you can please tell us what brought you all here to Dr. Shor.
Back on March 25th, my wife and I were celebrating our 10-year anniversary, and we were preparing for the ceremony. And this one got away from his caregiver, and we found him drowned in a pond, in a koi pond. So we resuscitated him, and we was airlifted to the hospital. We spent some time there. We spent about a month there, and then we went to inpatient, and we just started doing research. We found groups that were support groups for the same type of injury, which is an anoxic brain injury, and any kind of treatment that we could find that could possibly help him regain some of what was lost. And one of the two things that kept coming up was hyperbaric treatment. So we started looking around. We found a couple different facilities across the country, but we live in Central Virginia, so this was the closest. So I called Dr. Shor, and I think a week later we were in here doing an exam, and we started treatment that day.
Oh, you didn't waste any time.
He didn't waste any time. As soon as we finished it, we came downstairs and they put us in the tank.
Yes, indeed. And how long was that session?
We did 40 sessions, each of an hour apiece. So that's what was recommended for his type of injury. And we just recently completed those.
And how have the results been so far?
The results have been amazing. Before we started, he was listed as minimally conscious, just basic life functions. We had to feed him through a G-tube, 100%. His vision was gone, and his overall cognitive ability was not there. He was just existing, and that was almost the gist of it. But now his vision has returned. His happiness and his temperament has come back. We're now we're doing 50% G-tube feeds, 50% by mouth. And he's doing incredible in therapies. We went from not sitting, not holding our head up, to we're working on walking. And we're using our hands to grab stuff and hold on rather than just feel.
Great news. We are so happy to hear that. Look at this young man. Hello there, Luke. We are so proud of you, young man. Oh, that's great. So these are some great results after the session.
They are. It's amazing what he's come from. And it was hard to see it for me because I was with him every day, but looking back from where we started to where we are now and how he interacts, just in general in his everyday life, how he lets you know what he wants now, how he can tell you, he's speaking words. He did regain some of that, some of what was lost, and he's just become the person that he was before the incident.
And compared to what you found him in that condition, from that moment to now is a miracle. It's incredible. We are so happy to hear that, like I said. And is there anything else, Joel, that you'd like to add before we let you go today?
It takes time. No injury you're not gonna see the results overnight. And that was the really hard part for us, is because we wanted it, we wanted it now. We wanted him back. But, patience is the key, and just continue with the treatment and you'll see. And sometimes it takes a little bit after the treatment ends. That's another thing I've seen, is that, the effects keep coming after the treatment has stopped. So just be patient and have faith.
Yes. Well, on that note, Joel, we'd like to thank you and your wonderful young son, Luke, for joining us and being guests on our program.
Thank you, guys. We appreciate it so much.
Welcome, Mavis. It's a pleasure having you on our program as well.
It's a pleasure to be here.
I wanted to begin, if I may, Mavis, by having you tell us how you heard about Dr. Shor and what brought you here.
I sought the treatment of Dr. Shor. I was misdiagnosed as having multiple sclerosis, and I was listening to a documentary called Under Our Skin about the Lyme disease, the epidemic of Lyme disease, and so I saw Dr. Shor, who is known for his services in this area, and was diagnosed with Lyme disease.
That must have been affecting your life in such serious ways, because Lyme disease is a very serious disease that unfortunately afflicts a lot of people get that in their lives.
Yes, so Lyme disease was causing headaches, it was causing fatigue, it was affecting concentration, and I also had floaters in my vision, so I had black dots that would move with my eyes.
So what treatment plan did Dr. Shor customize for you that you've been going through?
I took several rounds of medication in addition to the hyperbaric oxygen treatment. And the hyperbaric oxygen treatment was particularly helpful in the fatigue. I had more energy, it helped my vision, I had greater clarity, and I had improved vision overall.
Oh, we're happy to hear that. And for the folks out there watching, could you please tell them about what your experience has been like with the staff here as well?
The staff was very courteous. The hours of operation were very accommodating. I worked full-time. I was able to come in first thing in the morning, get the hour treatment, and leave and get to work on time. So it was very helpful.
And before we let you go, Mavis, for all the folks watching, would you recommend HBOT of Northern Virginia?
For anyone experiencing Lyme disease, I highly recommend that they seek the services of Dr. Shor and come to HBOT of Northern Virginia.
Well, on that note, we'd like to thank you as well for joining us and being a guest on our program. It was wonderful having you with us today. Some very powerful results, Doctor. Well done.
Thank you.
Now, we're literally out of time, Dr. Shor, but I wanted to ask you, before I let you go, you and your practice, HBOT of Northern Virginia here in Reston, Virginia, have certainly established a reputation for excellence. As I mentioned earlier in this interview, you're widely recognized as a leading doctor in your field. You're helping so many folks in this region, in this community. And I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
We listen to patients, and it's the time we spend with our patients. We are not compelled by brief visits or volume of patients. We know that the complexity of those that we see often requires a great deal of time to hear their whole story, to generate a game plan that makes sense given their individual complexities. And so it's the personalized time that we take to listen to patients.
Yes, indeed, and your staff follows your lead. You know, the patients love you all. And on that note, we'd like to thank you, Dr. Shor, for joining us, educating us, and being a guest on our program. It was our pleasure having you on.
My pleasure. Thank you.